Rachel, thank you. Well, there's troubling new data. About 100,000 Americans died of drug overdoses in 1 year. Health officials say the never-before-seen milestone is tied to the COVID-19 pandemic and a more dangerous drug supply.
Overdose deaths have been rising for more than 2 decades now and accelerated in the past 2 years here. According to new data, overdoses have jumped nearly 30% in the latest year. Experts believe the leading causes in overdoses are fentanyl and the pandemic. Today, we're joined by Dr. Craig Allen from Hartford Hospital to talk more about this. Dr. Allen, thanks for being with us.
Thanks for having me on.
You know, hopefully we're at the end of this. Do you think that we've reached the height of this overdose epidemic right now as you're seeing it?
Well, I always hope that we've reached the height of it. I hoped that last year. I hoped it the year before that. But nonetheless, the numbers continue to go up. So tragically, we need to keep working as hard as we can and finding new strategies to connect with people and intervene and save lives.
So in your experience, what is the leading cause in overdoses? We touched on this. We were talking about fentanyl, which is incredibly powerful, as well as the pandemic. What are you seeing?
Yeah, you know, the rules changed with synthetic opioids like fentanyl, easy to get. They're inexpensive and they're incredibly powerful, hard to predict their response. Even people that are regular users, seasoned users, can overdose and die from that drug. And it's mixed in with other drugs. It's mixed in with cocaine. It can be mixed in with, someone thinks they're getting a pressed pill, an opioid analgesic, OxyContin or Vicodin, and in fact, it's illicitly made and it has filler and it's got fentanyl in it. So it's incredibly dangerous. There was an alert out earlier this week that it could possibly even be in some parts of the marijuana supply. So you have to be very, very careful. You should have naloxone, the opioid overdose reversal medication, ready. You shouldn't use alone. It's a scary world out there.
You know, Dr. Allen, looking at your camera view right here, I see a whole bunch of degrees. You've been in this field probably for quite some time and seen a whole bunch of trends. How big of an influence did this last 1.5 to 2 years have on people getting into drugs and using and overdosing in your experience from what you've seen?
Yeah, you know, when you have stressful, incredibly stressful situations like COVID, and this included quarantine and isolation, that disrupts people's ability to cope. It disrupts treatment programs. It disrupts boots on the ground harm reduction programs out in the community. So when people get stressed out, there's more depression, there's more anxiety, and that also leads to increased use. I think the people at greatest risk were either people in early recovery or people that were using and maybe on the verge of developing an addiction. And these kinds of stresses and pressures pushed people further. So I think we're continuing to see the fallout, both with mental health problems and with these associated substance use disorders and opioid overdose deaths.
So, doctor, what's the solution here? I know obviously this is a very complex issue, but how do we stop this? What needs to be done?
Treatment works, decreases your risk of overdose death by over 50%. Medications for opioid use disorder, the 3 FDA-approved medications. Naloxone, the opioid overdose reversal medication, should be everywhere and easily accessible. Helping people and meeting them where they're at, so community-based programs, reaching out, connecting with folks. If you can reduce the harms, you can reduce the deaths. Treatment programs were disrupted, but they're back in action. And, you know, at Rushford and Hartford Healthcare, we have openings in our programs. So trying to get people connected to that care is the real challenge, or connecting with them and helping to reduce the risks until they can get into care are the opportunities we have.
It's a conversation that a lot of people avoid having and find almost irrelevant until they need to have it. And it's so important, so we should continue it. Dr. Allen, we appreciate your time. Thank you.
Thank you.
Thanks for having me on.
More to come this hour here on the news at 4 o'clock. Over 900